This is video assignment of the anatomy of uterus presented by Dyan Phipps. Learning objective: after this presentation, we will be able to gain the understanding of the anatomy and physiology of the uterus, recognize common pathology of the uterus. Psalm 139 verse 13 said, "You made all the delicate inner parts of my body and knit me together in my mother's womb." God wove us or put our internal organ in our mother's womb or uterus before birth, and during our life, He wanted to weave us into something beautiful and useful for His glory. This picture is the reflection of pelvic peritoneum as seen in a sagittal section of the pelvic. The peritoneum passes downward of the front of the upper two-thirds of the uterus and forward over, and then passes directly to the posterior surface of the anterior abdominal wall. The uterine of Douglas pouch. It lies between the rectum and the uterus. The shallow uterovesical pouch is formed between the uterus and the bladder. The uterus directly overlies the bladders and the rectum posterior to the uterus. Situated between the urinary bladder and the rectum, the uterus is the size and the shape of inverted pear. Anatomical subdivision of the uterus include the dome-shaped portion above the uterine tube called fundus, the major tapering central portion is the body, and the inferior narrow portion opening to the vagina called cervix. Before the first pregnancy, the uterus measure approximately 7.5 centimeter long, 5 centimeter wide, and 2.5 centimeter thick. In its normal position, the uterus bends anteriorly near its base or anteflexion. The body of the uterus lies across the superior and posterior surface of the urinary bladder. When the uterus bends backward toward the sacrum or retroflexion, as this condition during pregnancy, the retroflexed uterus generally becomes anteflexed spontaneously during the 3rd month of the pregnancy. The function of the uterus: when uterus accepts a fertilized ovum and implanted into the endometrium, it provides the mechanical protection, nutritional support, and waste removal for the developing embryo and the fetus. The anatomy of the uterus wall consists 3 tissue layers. The inner layer, the endometrium, is the most active layer, highly vascular layer. The endometrium divided into 2 layers. the stratum functionalis, functional layer. This layer closer to the uterine cavity. This is shed during a menstruation. The deeper layer, the stratum basalis, or the basal layer, is permanent. It repeatedly gives rise to a new stratum functionalis after each menstruation. The middle layer, or myometrium, makes up most the uterine volume and is the muscular layer composed primarily of the smooth muscle cell. This layer consists of 3 layers of the smooth muscle fiber, and the thickest is in the fundus area and the thinnest in the cervix. You can see here in the cervix really thinner compared to the top one. The outer layer of the uterus is the serosa or perimetrium. The outer layer is a thin layer made of the tissue epithelial cell that envelope the uterus, and it is part of visceral peritoneum. And laterally, it becomes the broad ligament. Anteriorly, it covers the urinary bladders and form a shallow pouch, the vesicouterine pouch. Posteriorly, it covers the rectums and forms the deep pouch, the rectouterine pouch, or the pouch of Douglas, the lowest point in the pelvic area, or in the pelvic cavity. Excuse me. The blood supply of the uterus mainly receives from the branches of the uterine artery, which arise from the branches of the internal iliac artery and the ovarian artery, which arise from the abdominal aorta inferior to the renal artery. In here, the uterine artery divides the descending limb coursing downward along the cervix and the lateral wall of the vagina. The ascending limb passes upward along the uterus and continues below the fallopian tube. The ovarian artery, which ordinarily arises from the aorta, passes along the ovary, dividing into a number of branches. At several places in the broad ligament, there are anastomotic connection between the tubal branch of the uterine artery and the ovarian artery. Now we come to the lymphatic drainage of the uterus. The lymphatic of the cervix uterine run 3 directions: transversally to the external iliac gland, run transversally, and posterolaterally to the hypogastric gland, and posteriorly to the common iliac gland. The nerve supplies of the uterus coming by inverted from the autonomic fiber from the hypogastric plexus and from sacral segment of S3 and S4, the parasympathetic. The sensory information reaches the central nervous system within the dorsal root of the spinal nerve, T11 and T12. Now we come to the suspensory ligament of the uterus. The peritoneum that covers the uterus continues laterally as a double fold, as known as the broad ligament. In addition to the broad ligament, 3 pair suspensory ligaments stabilize the position of the uterus and limit its range of movement. The uterosacral ligament, which extend from the lateral surface of the uterus to the anterior face of the sacrum and keeping the body of the uterus from moving inferiorly and anteriorly. The round ligament arises on the lateral margin of the uterus, just posterior and inferior to the attachment of the uterine tube. This ligament extend through inguinal canal and end in the connective tissue of the external vagina. The round ligament restricts primarily posterior movement of the uterus. The lateral or cardinal ligament extend from the base of the uterus and vagina to the lateral wall of the pelvis. This ligament tends to prevent inferior movement of the uterus. Now we come to the common pathology of the uterus. The uterine fibroid are the most common benign tumor in the women of childbearing age. Leiomyomas or myomas that people normally refer. The fibroid are developed around the wall of the uterus. The category of the fibroid based on where the urine will grow in the fibroid will grow in the urine wall. The subserosal fibroid, this fibroid develop under the outside covering of the uterus, then expand outward to the wall, giving the uterus a knobby appearance. The subserosal fibroid can develop a stalk or stem-like base, making it difficult to distinguish from an ovarian mass. These are called pedunculated. Intramural fibroid. These develop within the lining of the uterus and expand inward, increasing the size of the uterus. The submucosal fibroid. These are just under the lining of the uterus. These are less common, but they tend to cause the most problem in the women, cause heavy bleeding, gushing, and very heavy and prolonged period. That's supposed to be my last slide, and this is my reference, and thank you.